If you want to break into medical device sales in 2025, there's going to be 7 core skills that every hiring manager is going to look for. I'm going to break down exactly what they are and how you can build them. My name is Matt Moran. I've been working in medical device sales for about 4 years now. I started out as a territory manager and worked my way up to area sales manager, where now I oversee multiple states in the Southeast. But before that, I studied athletic training in Pennsylvania and worked as a certified athletic trainer. That background in anatomy and healthcare turned out to be one of the biggest advantages when I moved into medical sales. But here's the thing, you actually don't need a medical background to succeed in this career. What you're gonna really need are the 7 specific skills. So these are the skills that are gonna separate the people who get hired from the ones that don't even get a callback. And by the end of this video, you'll know exactly what hiring managers are gonna be looking for and how to start building these skills yourself. Skill number 1 is going to be clinical knowledge and anatomy. So clinical knowledge and anatomy in medical device sales, you're there just to sell a product. You're working directly with surgeons, physicians, and clinical staff who've spent years in medical training. If you can't speak the language, you're not going to really earn any kind of trust with them. You really do need to understand basic anatomy, medical terms, body systems, and how different procedures work. So let's say you're selling spinal implants, or really any kind of implant in particular. You need to know the difference between, the procedure they're doing, number 1, and the procedure they're doing, number 2. And you need to understand why they would choose a certain implant, where it would go in the body, what a surgeon might pick versus one device over the other. So my background in athletic training helped me here, not completely, but a little. So I already had a foundation in anatomy and physiology and how the body works. So it helped me talk to physicians and understand what they needed during surgeries. And I was able to really anticipate their questions before they really, had the chance to ask. So the good news is you don't have to spend 4 years in college to build this skill. So there's plenty of online resources and anatomy courses that are going to teach you exactly what you need to know. You're not trying to become a doctor, obviously. You just need to know enough to have real conversations with doctors and nurses. The bottom line is that clinical knowledge isn't optional. It's the foundation that everything else is built on. So if you don't have it, you're going to struggle. But if you do have it, you're already ahead of most candidates out there. So number 2 is going to be professional email and proposal writing. Professional email proposal writing, this might not sound exciting, but trust me, this skill matters way more than you think it does. In medical device sales, you write a lot of emails, plain and simple. Cold emails to physicians, follow-up messages after meetings, invitations to lunch and learns, proposals to hospital systems. And here's the thing about these emails, the people you're writing to are very busy. Surgeons don't have time to read a sloppy, unclear email. If your message isn't straight to the point with the value that's intended, it's probably going to get deleted. You don't need to write emails that are completely polished, professional, and persuasive. That means proper grammar, a clear structure, and making it easy for the reader to take the next step. You're not texting a friend, you're representing the company and trying to build that relationship with a high-level decision maker. So the same goes for you when you're writing proposals or presentations for hospital admin. So you've got to see things from their side. These people are looking at multiple vendors, multiple products, and multiple reps. So if your messages don't make you stand out as someone who's sharp, organized, and credible, you're not going to get their business. So if writing isn't your strong suit right now, that's okay. It's a skill you can build on. Practice writing professional emails, get feedback, pay attention to how successful people in business write. This is one of those skills that's going to set you apart in a huge way. The next is going to be presenting clinical data to physicians. Medical device sales isn't like selling typical products, so you're not really just talking about products, features, benefits. You're presenting clinical evidence as well. So you're presenting preclinical data, clinical trial results, FDA guidelines, and device specs. So physicians are very well educated, as you know. They want to see the data. So they want to understand why your device is better than the competitors. And, they're going to ask tough questions, so you got to know. So you need to know how to read and understand clinical studies. You need to understand what preclinical data is versus clinical data. So you need to be able to explain why one study design is stronger than another. And you need to do this all in a way that's clear, persuasive, and all at the same time, not really overselling or twisting any kind of evidence. So one mistake you can't ever make is overstating what preclinical data shows. So here's an example for you here. So imagine if you're presenting a study to a surgeon and you say, this device, it reduces infection rates, but you didn't mention that the study only had 20 patients and no control group. So that surgeon's probably going to shut you down immediately because they know what solid evidence looks like. So if you want to learn all of these 7 skills in depth, this is something that I want to mention here. What we cover in the medical device sales and course careers is going to be all of this. So I know this because I built it to cover specifically everything that you're going to need to know in order to break in. So how to understand that clinical data, how to present it to physicians, how to answer their questions with confidence. So you'll get access to modules on all of these things, you know, device classifications, product knowledge, and everything else you need to be job ready. So if you're serious about breaking into it, check out coursecareers.com and start with the free intro course to see if the career is a right fit for you. Next skill is going to be operating room skills and etiquette. So operating room skills and etiquette, this is what makes medical device sales completely different really from any other kind of sales. You're not really going to be pitching a product in a conference room a lot of the time. You're actually in the operating room during surgeries, helping the surgeons use your product. So if you've never been in an operating room before, it's going to feel extremely overwhelming at first. I know it was for me. There's a lot happening. So there's strict rules about staying sterile. You need to know where you can stand, what you can touch, and how to move without getting in the way of the surgical team. Your job as a rep is to know what the surgeon needs before they even ask for it. So that means knowing the procedures inside and out, knowing which instruments and implants will be used, and being ready to hand things over and answer questions without disrupting anything. So you also need to communicate clearly when things get intense. If the surgeon asks you a question in the middle of the procedure, you need to know the answer right away. So no fumbling or uncertainty. And on top of that, you're running trays, checking in surgical sets, restocking implants, and after a case, working with the surgical staff. So that includes building relationships with the nurses, scrub techs, and the sterile processing department team. That's the, SPD, getting them on your side. Your job becomes way easier after that. You can't learn operating room skills from a book, so you really do have to develop them by shadowing experienced reps, going through company training programs, and getting the hands-on experience. But once you have these skills, you're not going to be just that salesperson anymore. You're going to be more of a trusted partner in the operating room. So here's the next one, CRMs and credentialing systems. Medical device sales is a numbers game, really, at the end of the day. You're managing multiple accounts, tracking your pipeline, following up with leads, and reporting back to your company. To do all of this well, you need to know how to use the sales tools and systems that the industry runs on. The most CRM system in medical device sales, or the most common one, is going to be Salesforce. Some companies also use HubSpot, but these platforms let you organize your accounts, log your interactions, and track your process, towards sales targets and see how you're performing. So if you've never used a CRM before, it might seem tough at first, but realistically, it's just a system that's used for keeping you organized and making sure that nothing slips through the cracks. So the better you are at using your CRM, the more efficient you'll be as a rep. You also need to understand credentialing systems. So before you can even step foot in the operating room or the hospital, you got to go through a credentialing process. So this usually involves platforms like VendorBait, RepTrax, or RepScrubs. So you'll submit background checks, vaccination records, and compliance training. So it is a lot of paperwork, but it is going to be required. The good news is that once you get how these systems work, they're generally a breeze. And then plus knowing how to use them shows hiring managers that you're tech savvy and you're ready to go from day one. In the Course Careers program, I'm just going to bring this up one more time. We walk through how to use, LinkedIn, CRM systems, all that kind of stuff. So you would, be ready to go. So these are going to be the technical skills that do make you job ready or going to stand out to those hiring managers. So the next one is going to be persistence and rejection handling. I'm not going to sugarcoat it at all. Medical device sales is super competitive. It's definitely not easy. So you're going to deal with rejection a lot, like a lot of rejection. You're going to get sent cold emails to get ignored. You're going to make phone calls to go straight to voicemail if they even get there. You're going to apply to jobs and hear nothing back. That's just kind of the part of the process, right? And the people who succeed in this field are the ones that don't give up. They keep networking. They keep reaching out to current reps on LinkedIn. They keep applying and following up. So when I was trying to get into medical device sales, I got the number for the person that was going to be hiring me, and I just kept calling him, kept hammering it away because I wanted to prove that I was serious and that I wasn't going to give up. So I really do think that was persistence is what got me hired. There's no big secret hack. It's really just about showing up every day and putting in the effort with it. It's about networking harder than most people are willing to do. Most people don't put in the work. They send out a few applications, don't hear back, and they just give up. Don't be that person. And once you land the job, the long hours and rejection don't stop. Medical device sales reps often work from 6 a.m. to 6 p.m. So you can be working weekends, you're on call, you're dealing with last minute surgeries and cancellations. If you love talking with people, you're comfortable being on your feet all day, and you're willing to work hard and don't get back down when things get tough, you're probably going to thrive in this career. But if you are looking for, more of a 9-to-5 desk job with no pressure, this probably isn't going to be for you. Next is professional presence and client-facing skills. In medical device device sales, you're the face of the company. So when a surgeon looks at you, they're deciding to trust you or support them in the OR. When a hospital admin meets you, they're deciding if they want to do business with your company based on how you show up. So this means you need to be good with people. You need to be confident, polished, and professional in every interaction. So you need to be comfortable talking to people, whether it's a quick 5-minute conversation in the hallway or a 30-minute meeting in a physician's office. You also need to think about how you present yourself. So look, I'm just being real here because appearance matters a lot when you're working directly with clients. You're representing a company in a professional healthcare setting. For example, visible tattoos, especially on your face or neck, can make it harder to get hired in some of these roles. That doesn't make that it's impossible, but it's something that you should be aware of. The goal is to make the physician feel confident that you're someone that they want in their operating room or someone handling, helping with their patients. So another thing that helps is being from the area you'll be selling to. Being from the same area as your customers makes it easier to connect. So physicians want to work with the reps that they, vibe with, and that familiarity can really help you out. And at the end of the day, it really just comes down to being someone people actually want to work with. So you need to be easy to talk to, someone they can trust, and someone who knows their stuff. If you can nail that, you're going to go far. So here's what I want you to understand. These are all learnable skills. You don't have to be born with them. You don't need years of experience to start building them. I came from the athletic training background, making just about $40,000 a year. I learned these skills, worked my way up. Now I teach people how to do the same thing. Entry-level med device roles typically start around $66,000 a year. In a few years, you can get up to $150,000 or more depending on your performance. So this is a career that can give you real long-term financial stability. And if you're serious about breaking into it, I would start with the free intro course at Course Careers, just to give you a good little look into what it is. And if you want to take advantage of the full thing, we'll teach you all of these 7 skills in that Course Careers course to help you land your first job. So I'll leave the link in the description if you wanted to go do that. So thanks for watching, and I will see you in the next one.